Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate and provide education from our guests' experience.
So this week's guest is Juliette Reeves. She's been a hygienist for 40 years. She's worked across several dental practices in that time. She's been involved in dental societies and associations.
Your practice experience is very much dependent on the support staff around you. You can have the most beautiful practice with all the latest equipment in the world, but it's the staff that make the practice. And again, I'm very lucky across the three practices that I work in.
She's currently a trustee for the Oral Health Foundation. She's got a very keen interest in nutrition and the relevance and the context within general and oral health.
When I was looking for this alternative pathway, little did I realise it was going to come into my treatment. I realised this is what I need to bring into my work as a hygienist and transform the way that I work. And I absolutely adore my job, So it changed everything for me, not by leaving the profession, but by bringing something else in, which made me feel, I'm doing the best for my patients,
We can't wait to explore these passions with you, Juliette.
With your hosts, Josh Hudson and Julia Bruin.
Oh, hello, Julia and Josh. Thank you so much for inviting me. I'm really looking forward to this today.
Good.
So thanks for having me.
Well, we're very excited to have you here. So, like I said, you've been a dental hygienist for 40 years, and perhaps think back to your early days in your dental career and think of three words that might describe that early time in your career.
Absolutely. It really doesn't feel like 40 years, I can say that. So that means I've had a whale of a time and I'm, really enjoying myself. In my early years, I would say it was very exciting. I was very keen, but I was also terrified at the same time as well, having just come out of school and seeing your first patient on your own. It was exciting but terrifying. Absolutely.
Yeah, I think a lot of people would resonate with that terrifying. So perhaps let's tease that word out, because I think we are all excited. We all think that we can create the nation of wonderfully dentally healthy people. But perhaps talk us through the terrifying word.
Bit. It really was simple things like, am I going to bring the patient back or not? Have I got this diagnosis correct? Is that what I think it is, or is it something else that I'm missing? It's all that uncertainty because you don't have those years of looking at the tissues and knowing exactly what it is. And that's really where the terrifying bit came in. I was very lucky though, because all the practices I've worked in, I've always had a very good supportive team. And that's what you need when you first qualified. You need good mentorship and you need a good supportive team. Somebody that you can just say, can you look at this and tell me, what you think? And if you've got that, it really, really helps.
Yes. And lucky if you find it early in your career.
Absolutely. And I think I've been very lucky across my career in always having good support. Absolutely.
So following on from that, you've obviously worked in many different places throughout your career. So can you tell us about the differences between those different places that you've worked in?
Yeah, absolutely. When I first qualified, I was in my 20s and straight into NHS practice, which most of the practice were then at that time, and this would have been in the 80s. Completely different experience to working in private practice. So really busy, 20-minute appointments, turning it all round, filling all the forms in. And I did enjoy it, but it was hard work because we didn't have as many responsibilities as we do now, and our scope of practice wasn't as wide, but it was still quite intense and hard work. Further on down the line, I think I spent about 15 years in the NHS, so I kind of felt like I'd paid my dues, I'd done it. And then I wanted to kind of expand a little bit more, and I was really interested in the chronic perio side, always have been. Happy as Larry if I'm up to my neck in blood and bullets, muck and bullets. Love it. So I went into private practice at that time, and that was a revelation because obviously we had longer appointments and there was more support and more clinical support. Currently, I'm working across three practices. And they are private practices, but obviously every practice has its own flavour and its own way of doing things. And I firmly believe that your practice experience is very much dependent on the support staff around you. You can have the most beautiful practice with all the latest equipment in the world, but it's the staff that make the practice. And again, I'm very lucky across the 3 practices that I work in. So I work in 2 practices that have a practice plan in place. So the patient pays a monthly subscription, and then they get their treatment. And then I work in a fully private practice. And that practice is interesting because that's where I see my direct access patients there. So in that practice, I am able to pay a rental fee for the room, and then I see my direct access patients and run it more as my own business. And that's interesting because you get to make decisions that perhaps you wouldn't make working for somebody else. So I love that. And my other 2 practices, as I've said, one is a DEM plan practice and one is a practice plan practice. And again, they run very similarly, but again, it's the staff that make it. So they all have their own personality and, different feel to them when you walk in.
Thank you. That's interesting to see different things that you're doing there. So you're obviously active in a lot of societies, like we talked about, and you are involved in the British Dental Hygiene and Dental Therapy Society. And you've held lots of different roles within that group. You've done executive, you've done regional work, but you're currently now on the education committee.
That's right.
So perhaps you can tell us what sort of projects they're working on in this society.
Yeah, so really started off, as you said, at regional group level. I would recommend all hygienists and therapists to be a member of their professional body because they give them so much support. And so much more support now as well. So there's mentoring programs, there's a legal helpline, there's all sorts of things that they can support you with. But also meeting up with your colleagues, particularly if you're the only hygienist in the practice. You need to have that interaction with your colleagues.
It can be a lonely time, can't it, when you're
absolutely
a solo hygienist in the practice?
Yeah, absolutely. And also sometimes you might be thinking you're the only one who's feeling this way or not recognising that or worried about something, and actually it's right across the board and you can talk to somebody about that. Yeah. So regional group meetings at the BSDHT, my particular region had a vacancy for the secretary, and I thought, okay, well, I quite fancy that. And I loved it, had a great time. And that just kind of naturally led on to other opportunities. So start at a regional level, if that's what you're interested in. And then the other opportunities will come to you to be able to be involved at executive level or, national level. And that was like a natural progression, really. And so after many years of working on that level, I was then invited to work on the education panel. So this was a new group. It was set up in 2016, I think. So it's been around for a little while. And our remit really was to try and get some regulation of the quality of the CPD that both the BSDHT were putting out, but also BSDHT have an accreditation program. So if anyone wants to create a program or a lecture or a course and they want it CPD accredited, the BSDHT can do that for you. And that's one of the things that the education panel do. So we don't look at, because we're not specialists in all subjects, we don't look at the content, but we look at the way in which it's put across. Are there adequate references, the quality of the references?
We all want to have good quality CPD, don't we? Yeah. So, actually, if somebody's fighting our corner for us and making sure that as a society things are being produced appropriately, that's a great project.
And even down to getting the certificates properly, because we know the GDC have very specific requirements, looking at that so that there's not difficulty when we then put our CPD into the GDC. So that's one of the projects. So it's just looking at the BSDHT regional group lectures and education right through to the oral health conference. So we look at the presentations there, and then independent lectures and things coming in from other people as well. So that's quite an interesting thing to do.
I think members, sometimes these things aren't always seen, are they? So it's nice to hear these things firsthand.
Lots of hard work behind the scenes.
I can imagine.
Yeah. And one of the most exciting things that is really new that we're doing now is we've put together a course for presenters, for would-be presenters. So a group of us, very seasoned presenters, have got together and backed by the BSDHT, and we're going to put on this presenter course. So we're going to teach our young, colleagues who wish to present or share their knowledge how to create a presentation.
That is super exciting.
Yeah.
That's really investing
Absolutely.
in the young, in the early years of people's careers, isn't it?
Really important. How to formulate their title, and also again thinking about the GDC requirements. What's the difference between a learning objective, a learning aim, and a learning outcome, and how to write those.
Yeah.
And then also practical things. So when I first started lecturing, that would have been about 20 years ago. I remember being very nervous and giving my lectures all from up here, the top of my voice, and not breathing properly and not knowing how to stop and take a breath and breathe from the stomach.
Yes.
And so we're teaching them breathing techniques and presenting techniques, and that's going to be great. So that's coming up in June 25th. So we're really looking forward to
best
to
of luck
doing
with that project.
Yeah, looking forward to that.
So you said you started off kind of locally and then got to more senior levels. I'm quite interested. Those projects sound like a lot of work. How much of your time does it end up taking once you get to these kind of higher positions, so to speak, or these more involved positions?
It can be busy. You definitely need to allow time for that. At the time that I was involved on regional level, the work would come in phases, in blocks. So just before a regional group meeting, probably a month leading up to that, it would be full on busy. And so it would come in stages. So it wasn't all the time, and you would be able to plan for that. You knew that was coming, so you would just make sure you had time free to be able to do that. Yeah. When we get onto the oral health conference, again, there's a large panel of us now on the education panel. So the presentations that need to be reviewed, they're farmed out to all of us. So we generally may get one or two. So it's not the whole conference.
Not too bad,
And again, before the oral health conference, that's coming. So you, again, can just put some time aside. So it does work. You can do it. Yeah, absolutely.
Just need to get that balance.
Absolutely, yeah. Just planning, really. Yeah.
Yeah, definitely. So changing kind of direction a little bit. So when we spoke to you before this, you mentioned that you'd achieved the AIDA implant auxiliary certification.
Yes.
So I think that's really interesting. I've never really heard about that, and I looked into it a little bit more. So can you just tell us a little bit about that and how you managed to complete that?
So there is a story behind that.
Okay.
We like a story on this podcast.
Absolutely. So 2012, take yourself back to 2012.
Yep.
10 years ago now. And a patient walked into the practice, into my surgery, and said, I just want to give you this, and handed me a big pan-oral x-ray. And I thought, okay, that's handy. Lifted it up to the light. I looked at it and thought, okay. And it was in those days, particularly in America, they used to plant one implant for every tooth. Yep. So this chap had like 6 implants in his top jaw, every tooth. And I looked at that and I thought, okay, what am I going to do with that? So I then smiled and said, yeah, that's absolutely great. Thought oral hygiene, lots of flossing, lots of this, lots of that, and then sent him away. And afterwards I thought, you know what, I should really know about that. I don't want that to happen to me again. I don't want to be in that situation again.
I think there's loads of people as well that end up in that position because, like you say, if you're not placing implants, but there's so many of them around now. Everyone's seeing them, and you need to have a bit of an idea at least of what to do.
Absolutely. And this was kind of 2012, and now they're in everyday practice, but they were just really coming into practice at that time, general practice. So I started reading the literature, and the literature at that time was very, there was nothing that agreed with one another, very controversial. So that put my head in a spin. And then I went off to Europerio 7 and was listening to these, fantastic lectures by the likes of Mombelli and Renvert and Mariano Sanz and, all those fantastic people, Tord Berglund, the granddaddy of implantology. And I thought, I understood it, and I thought, right, I've got really good information, but I now need to know practically what I'm going to do. And I looked around for courses, and the only one I could really find that I liked the look of was the ADIA one, which is the Association of Dental Implant Auxiliaries. So it's run from America, and it's a part of the ICOI, which is the International Congress of Oral Implantology. So I went over to Florida.
Nice.
I thought that's where I need to be. So I went and I did. It was a 3-day course, very intense. Loved every minute of it. Slightly different to what we would do in the UK, but I could see the difference between America and, Europe. Came home, started putting it into practice and thought, you know what, I need to share this. So end of 2012, started running implant maintenance courses, got some companies on board, and I ran my last one just before lockdown. So, that's been an absolute pleasure to do that. And having been in implants for so long, having been around for so long, I saw my first implant in 1981. It was one of those little keys, looks like a radiator key. Yeah. It was one of the first ones. Yeah. So that's how long I've been around. And to see how the protocols have changed and to see how the techniques have developed, the materials, the types of implants that we have now has been really great. It's been a very exciting journey to watch that. And of course, to be able to pass that information on to our younger ones coming along. And even now, I think they're still very nervous about implants, and we still need to be running these courses to give them the confidence that they do actually know, but they just need a little bit of guidance. Yeah, so that's the story behind the ADIA.
Yeah, 100%. So I do some work with dental foundation trainees.
Yeah.
And we're always talking to them about what kind of stuff they want covered. And it's always, I see patients with implants and I don't know what to do with them.
Yeah.
So, I think it's great to be sharing that with everybody. And like you say, the whole dental team, it's not just...
Yeah.
And we're seeing so many more, like you say.
Absolutely.
I mean, every week somebody's kind of coming in with something, aren't they? So
absolutely. Yeah.
So moving sort of slightly sideways to something else that you're very passionate about, and that's clearly nutrition.
Yeah.
I would consider you as an authority in this subject. So, really, I think this whole nutrition, periodontal disease / health.
Yes.
Can you perhaps tell us how you got first interested in that sort of subject?
Yes. So again, another story, 1993. It's not a very inspiring start, I have to tell you. So I'd been qualified. I qualified in 81. So I've been qualified over 10 years, working away and kind of getting a little bit disappointed that some of my patients weren't responding clinically to the treatments that we were providing them, even though the oral hygiene was good. Particularly youngsters who were getting gingival recession, and they'd say, well, what can you do? What can you do? And I think, well, they can't brush more and they can't floss more because the teeth are clean. So, yeah, but why am I getting recession? What can you do? And I used to think, well, what can I do? I can monitor it. Yeah, but what if it gets I don't know. So I started to feel a little bit, disillusioned really. And I thought I was looking for something else. So trying to take a step sideways from perhaps, dentistry. And I thought, okay, what can I do? And I saw this course for healthcare professionals. It was nutrition. I thought, okay, well, I know about that. I know about nutrition. I'll go along and just refresh my interest and then, see if anything resonates with me. So what I didn't realise when I got there is I didn't know about nutrition. I didn't know about nutrition at all. I knew about sugar and caries, but I didn't know about nutrition.
Yes. Yeah.
And over that 3 days, the things that I was learning and the things that I was hearing really started to resonate with me, and a little light bulb would go off and say, that's what's happening to that patient. That's what's wrong with that patient.
Yes.
And these little pings kept kind of happening in my head. And I thought, okay, this is going to be the thing. This is what I'm interested in. So I then went off and did a 2-year diploma course. So a lot of the research in 1993 was relative to dental caries and hard tissues, not the soft tissues. And a lot of the research, particularly around nutrition, was being done on animals, mice and rats and things. And although it's interesting, you can't directly extrapolate that to humans.
Yes.
So it was a difficult time. And there wasn't much in dentistry. So with this background of nutrition and this chronic inflammation, I started to research and try to pull things together to create a scientific protocol, because at the time, nutrition was very much alternative medicine. And I know we don't realise that now, because now it's very much a part of what we're doing. But this is 93, 94. And it was only really when we discovered, probably 20 years ago, the systemic oral health connection.
Yes.
Once that happened, the mouth came back in the body, because prior to that, the mouth was kind of a different area over here somewhere. It was a different area altogether. It wasn't even related. So suddenly the mouth came back in the body, and then it changed. Then we started to get really good quality research looking at chronic inflammation, oral health, and, all the underlying nutrition influences.
And of course, you talk about the research element of it.
Yes.
But actually then perhaps with the introduction of all of this, people were looking at their own patients that they'd perhaps seen for a number of years, or that they had talked to their friends about this patient, or heard about those case studies that I think you're right. It was an exciting time, and it's just grown and grown and grown. And the fact that, here within the Eastman, we're doing research on the link with Alzheimer's and periodontal disease. Diabetes, of course, has been a very well-established thing. But, this Eastman, we're doing really cutting-edge research on the health of the body and the impact that has on periodontal health. So
it's fantastic.
It's nice to see that it's progressed considerably since those times 20 years ago.
Absolutely. And of course, I've been very delighted the Eastman have had me along to run nutrition courses at the postgraduate centre. So that's been really great. We've always got lots of interest in that. So yes, that was the beginning of my journey, really. Yeah. Looking at systemic inflammation. And of course, now we live in the inflammation age, don't we? We understand chronic inflammation so much more clearly now than we did 20, 30 years ago.
So I'm interested to know, so there's a huge amount of knowledge that you've got now in that area. How do you pull that into your everyday practice when you're seeing patients? How does that nutritional link come into that?
So I mainly use it for patients who have this very aggressive chronic inflammation. So we know there are patients that have loads of plaque on their teeth, no reaction in the tissues, never get anything wrong. And I was seeing a patient the other day and looking at all the plaque on the teeth and thinking to myself, there's no response in these tissues at all. There's no periodontal disease here. Then we get the others, tiny bit of plaque, big response in the tissues. And you're thinking this is not just plaque control because there's hardly any plaque there. So it's for those patients that we take a more holistic approach, that yes, it is about their plaque control, but there's also a lot of lifestyle factors that we now recognise are associated with this chronic loss of tissue, this aggressive type of periodontal disease. And that goes right down to stress, getting enough sleep, getting good nutrition, and controlling the biofilm as well. So our understanding has really opened up since the 80s and 90s, and it's great. It's such an interesting area for our clinicians today, because they've got all that background information that's there for them, and it's very enjoyable to do and very, very satisfying. And that's why I'm still a dental hygienist. So when I was looking for this,
patients make happy hygienists, and all of the other group. We're talking to you as a dental hygienist, but actually, ultimately,
absolutely,
a happy patient does make for a happy person who's treating them. So
absolutely, when I was looking for this alternative pathway, little did I realise it was going to come into my treatment. I realised this is what I need to bring into my work as a hygienist and transform the way that I work. And I absolutely adore my job. Yeah. So it changed everything for me, not by leaving the profession, but by bringing something else in, which made me feel, I'm doing the best for my patients. Yeah.
Well, that's what I was going to ask. Did you ever think about pursuing nutrition and leaving behind dentistry? Was that ever on the
I used to do parallel. So I did used to work as a nutrition consultant. At the time, you wouldn't realise it now, but in the 80s and 90s, at the time, bringing nutrition in was a little bit controversial. And it was a little bit like, when we first used to do whitening, it wasn't a dentistry. It was not a part of dentistry. It needed to be separated from dentistry because it was, cosmetic. So nutrition was a little bit like that. So I would talk to the patients about nutrition and perio in the dental surgery, and then we would arrange for a nutrition consultation at a different time in a different room. That's how it worked out. But then what happened was I started to teach nutrition because I wanted to share this knowledge, because I'd had so much success and felt so happy in my career. It was a real, another bow to my arrow to my bow, really. I was really looking to be happy to doing that I started to create nutrition courses and to write and to share this. And of course, that became very time consuming. So I decided there's lots of really good nutrition consultants out there that are trained. across the board, but there's not many people who apply nutrition to dentistry, and that's probably where I need to focus. So I dropped the general nutrition consulting and then focus specifically on teaching nutrition and treating patients with nutrition, and also trying to get across the evidence base, the scientific background, that it wasn't an alternative treatment. And of course now it is very much part of our treatment, but back then it wasn't. Yeah.
That must have been very exciting to see that progression.
Absolutely.
And I can hear the passion in your voice there, that you are clearly passionate about it. So
yeah, absolutely. Yeah.
So which kind of brings me on to my next question, which is what something, in inverted commas, in the dental industry should we either start doing or stop doing, do you think?
I think in terms of a clinical level, we need to stop trying to do everything in one appointment. Those days are gone. And I can remember, as a new hygienist, agonising over whether to bring a patient back or not. We need to realise you're not going to get everything done in one appointment. And actually, a little bit of tissue resolution in between treatments is always a good thing. It never did anybody any harm. So never be worried about bringing a patient back. In fact, it can be advantageous to the patient. The thing we need to also start doing is, when we first see the patient, is to let them know right from the off, am I going to be able to do this in one appointment or not? Yes. So not just perio, but I'm thinking about the cosmetic stuff, the staining. And right from the off, I'll look at it and I'll say, wow, there's lots of stain there. We can do something about that, but it won't get done in one appointment. Tell it right from the start. Yeah. Then the patient knows. And then if you get it all done and they're happy with that, well, then that's a bonus. They haven't got to come back. I think
we're talking about managing expectations.
Absolutely.
You know, and
yes. And if they want more, then they can choose to come back. So do it right at the top of the appointment. Don't go stressing and working away and then at the end saying, oh, there's still stain there, you're going to have to come back. Do it right at the top of the appointment.
I think that's really great advice for some of our listeners who may be listening in the very early stages of their career. That's
and we've all been there. We've all sweated and worked away and then felt bad that we haven't completed in one appointment. Don't try and do that. Yeah, absolutely.
I think it's that classic explanation, not excuse phrase, isn't it?
Yes. Yeah. Perfect. Yeah.
So as Julia's already mentioned, you're very passionate. You're super keen on sharing all your knowledge with people. So I want you to imagine I'm going to give you a big screen in Piccadilly Circus and you can put any message that you want on there for everybody to see.
Right.
What message would you want to get out to the public?
The message, I think, would be healthy mouth, healthy body. They're both connected. Your mouth is a part of your body. And for years, we've had patients turn up and say, yeah, my gums have always bled now. They've always been like this. That's not healthy. Healthy mouth, healthy body. That's the connection. It's part of your overall health. The mouth is back in the body. Yeah, absolutely.
Definitely. And it's amazing the response from patients when you start to tell them about the link to heart disease, Alzheimer's, all these other different things. And then from my experience, people do suddenly start taking an interest. Yeah. Especially if they've got family history of any of those things. So
absolutely. And one of the things I find a really big motivator is actually bleeding scores, because we've always been focused on plaque scores, my generation. Bleeding scores. Taking a bleeding score and saying you have a 60% bleeding score, and you can see the reaction in their face, and that's an indication of how much inflammation is in your mouth. And it doesn't just stay in your mouth. Your blood goes all around your body. And then they come back and it's 26. And it's really powerful. Rather than just plaque scores. Bleeding scores really powerful for motivation.
Or just chastising them, saying it's not good enough, it's bleeding everywhere, or it's bleeding around your molars. That's not terribly helpful. But I think the number element, that's why one of the reasons why we've continued doing that sort of element in our student care really for our important. Patients here, because I think the numbers mean far more than saying good, poor, needs improving,
exactly.
Yeah.
All of those words.
Yeah. I'm also my generation from plaque scores, the good, fair, poor scoring system, which doesn't help anybody, does it? So bleeding scores are your thing.
So I sort of started off asking you to describe 3 words in your very early years of your career. So let's fast forward 40 years. Yeah. And I'm hoping that those 3 words may have changed.
Hopefully won't be in there anymore.
So perhaps tell me about your 3 words for
Yes,
your career now.
Okay, so you're right, Josh. Terrified doesn't feature, which is great. Much more confident. Very happy with what I'm doing and very motivated. Yeah. So that's kind of where I am now. And it is basically just an experience thing. So for all those hygienists out there who, may have been qualified for less than 10 years, it gets better, and at the end of the day, you still know more than your patients know. So even though you feel like you're still missing some knowledge, you still have more information and more knowledge than your patient has. So always rely on that. But it gets better and it gets easier, and you will reach a point in your career where you look at something and you know what it is straight away. It does get better. Yeah. And
finding something you're interested in and pursuing that. I guess there's no point in being unfulfilled doing something that you're not enjoying. And I think you've demonstrated there's a few points in your career where you've had that kind of crossroads and you've identified something different, and that's completely changed things. So identifying those areas and following those opportunities.
Finding out the bit of dentistry that you love and focusing on that and building that, rather than looking to leave the profession. Bring what you love into what you're doing, because ultimately, at the end of the day, when we were students, we all loved what we were doing. We all loved it. It's just when you get out into practice and, have the pressures of working to time and, all the other pressures that come along, remember what it was that you loved and bring that back into your professional life. It really makes a difference. Yeah.
So following on from that, a key theme of this podcast is to try and share experiences of clinicians like yourself that have followed those more unconventional pathways, done maybe some different things. And with that in mind, if there's any colleagues listening that are maybe stuck in a bit of a rut at work, or maybe they've lost that enthusiasm or that motivation, what advice would you give to them?
I think perhaps the first thing to do is to look at why you're feeling like that. It could just be the practice that you're working in. It could be that you haven't got the support around you. And as I've said before, it's really all about the team and finding that your home, where your home is, working with people who are like-minded and give you support. And I said I have been qualified 40 years, and I would say I've been at home in my practices for the last 20 years. So it took me 20 years to find that, and it's out there. It is there. You need to find it. So it might actually be your circumstances. Treating patients every day is very stressful as it is, without having practice politics to deal with as well. So we need to work as a cohesive team. And then the other thing to do is to think about the thing that you really loved when you were training. What is the bit of is it caries? Is it minimally invasive dentistry? Is it perio? Or what is it that you really love? And focus on that and try to bring that more into your practice. But also seeking mentorship and seeking counselling as well when you're very stressed. We know the BSDHT now have a counselling service and a mentorship service. So sometimes it's hard when you're in the hole to see the light and dig yourself out. It needs somebody from the outside to look in and guide you. But always remember what it was. Why was it you went into dentistry? What was it you loved? Focus on that and try and change that.
So you're a trustee on the Oral Health Foundation.
That's right.
And have been for some time now. So talk us through perhaps some of their exciting projects that they're working on at the moment.
Yeah, absolutely. So one of the things that a trustee does, it's mainly governance. Because it's a charitable trust, it is governed by the Charities Commission, and we need to make sure that we are compliant with their regulations. So that means overseeing the way in which the charity is run, making sure that the charity is financially safe, because we're dealing with other people's money, but also making sure that any projects that we get involved in are aligned with the core values of the Oral Health Foundation. Now, that's not to say that we don't know about any of the events and the projects that come along. We don't create the events and the projects, but we oversee them. However, we get to get involved in them by looking at how it's going to be rolled out, what the resources are. One of the latest ones that the Oral Health Foundation have just launched is the Truth About Tooth Decay. So this is a hub, it's on their website. And I have to say, if you haven't looked at their website for a little time, go and have a look, because the resources are tremendous. The resources for the public, it's a public-facing charity, but also they provide resources for the profession as well. So this new campaign about the Truth About Dental Decay is really a public-facing campaign, because 39% of the adult population don't go to the dentist regularly.
Yes.
They're not going to hear about decay.
And certainly COVID has brought, this strange thing about COVID, isn't it?
Yeah.
I've had patients who've come in who've said, because I haven't seen you for a long time, I've been super good. And there've been other patients who've come in and said, I haven't been super good because I haven't been seeing you. So, there's always a bit of a conflict there. But I think this whole self-care, taking ownership for your own mouth, and this is a well-respected, established society
Absolutely.
that you're a trustee for.
Yes.
So I think it's really good to hear about projects and initiatives that are aligning to really what we all believe in when it comes to good patient care. So
yeah, absolutely. So this campaign is really to teach the public, and we think we know, the public knows that sugar causes decay. But unless they come into practice and they hear us talk about nutrition, diet, decay, fluoride, they're not going to hear that anywhere else. They might hear it on the odd television advert from our big companies who, absolutely do a brilliant job at getting the message out. But they're not going to hear any joined up information, any really good, reliable information. And so that's what this project is about, getting all that information out to the public. So, nutrition habits. Also the fact that the health of their mouth is related to the health of their body. Fluoride toothpaste. And another part of this initiative is to teach the public how to use a high fluoride toothpaste. And there's also professional information about that as well. So obviously they've come to the dentist. We've recommended a high fluoride toothpaste, given them prescription, and off they go. You don't share it with your family because it's a fantastic toothpaste. It's just for you. It's high fluoride, so it's a prescription medicine for you. So it's really important. And then for the profession as well, there's some fantastic fact sheets and guidelines on how to prescribe high fluoride toothpaste, and this campaign has been backed in partnership with Colgate as well. So when you look at some of the campaigns that the Oral Health Foundation do, they always look after the public, but they also look after the profession as well. Fantastic information there. So that's one of their new ones.
Yeah, no, thank you.
That's great.
So another campaign that, of course, the Oral Health Foundation are very much aligned with is the Smile Month campaign, which runs from the middle of May to the middle of June. And the 2022 theme was Every Mouth Deserves a Healthy Smile, which I thought was lovely. But the information that they put across this time was really very valid. So looking at nutrition, obviously, and diet and seeing your dentist regularly. But one of the things they did incorporate was how to make dentistry more affordable, because we are seeing dental poverty, aren't we?
Yeah.
Definitely. Yeah, very sad to say. I think that is one of the legacies that will come out of COVID. Dentistry, I think, has sadly been a big victim. And we're going to see a lot of poor nutrition and all sorts of health problems, I think. And so the advice that was given was, number one, try and establish if you are entitled to NHS dentistry. But secondly, to keep going and seeing your dentist, because we know maintenance is much cheaper than large treatment plans. So I thought that was really a good piece of advice for the public, and also to seek out a dental plan. So there was some very practical advice incorporated there in the 2022 Smile Month campaign, which I thought was great.
Well, Juliette, thank you so much for coming and sharing your experiences and your knowledge with us. I'm sure Julia will agree. We've both learned a lot, and it's been a really interesting.
Great to have you here.
Thank you. So I've had a really great time. It's been great talking to you about stuff that I love. So thank you for the invitation to speak to you today.
Perfect. Thank you.
Thank you.
We hope you have enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe, and listen out for future episodes.